So outpatient and inpatient treatment and trying to make the right decision can be really tough. So you are looking to do inpatient treatment. So inpatient can be a hospitalization, which is a medical benefit. So you go there for, say, refeeding, you go if you have a medical abnormality, and you also utilize it if you need something like an inpatient psychiatric stay. That is an inpatient stay. There's also residential treatment where you go when you're not able to make change as an outpatient, where even if I work on this stuff hours and hours a day and I go to treatment, when I go home at the end of the day, I can't make change. That's when you consider going somewhere like residential. And so that's not inpatient per se, but residential is 24 hours a day. You are there, you sleep there, you do all your treatment there, and that's what that is. When it comes to outpatient treatment, we have different levels. So there's a pretty big spectrum. Outpatient treatment can range from just outpatient therapy, which is an hour a week with your therapist, maybe see a dietitian, maybe see your doctor once in a while, to all the way to something like intensive outpatient treatment or partial. And with intensive outpatient treatment, you're looking at least for us, ours is a 4-hour block of treatment, but there's a minimum of 3 hours of treatment each day for a minimum of 3 days. So with the Livewell program, we actually have 4 hours of treatment 4 days a week that we run actually twice a day to make sure it works with patient schedules. But with outpatient and inpatient treatment, here's the bottom line question. Are you motivated enough to put the structure in place in your life to be able to make change when you're not physically in the treatment office? That's the question. And are you able to make change in a way that allows you to be able to continue to stay medically stable? If you are medically unstable, so if you have multiple methods of purging with a low body weight, if you have a low body weight to the point where you haven't eaten in so long that it actually would be dangerous to refeed without medical supervision, that's when we're looking at doing something like an inpatient stay. As often as we can, we try to keep people in outpatient, and I'll tell you why. We keep them in outpatient because you need to be able to do the work. You need to be able to make the recovery-based change in the world you're going to live in. When you're in residential, when you're in inpatient treatment, it's done for you. It's not like it's not hard. It's hard. You still have to do the work. And sometimes it's really necessary. But at the end of the day, at some point you have to leave. At some point you have to leave, and you have to go to school, and you have to go to work, and you have to pick your kids up from school, and you have to be able to do it in a way that allows you to stay healthy and safe. And until you can really challenge that in the outpatient environment, you really can't be recovered. And so the real heavy lifting when it comes to treatment is definitely outpatient.